Good morning, Mr. Smith. I understand you're here today to learn how to give yourself insulin injections. Is that correct?
Yes, that's right. My doctor has decided to start me on insulin because my blood sugars have been higher lately. I'm not sure how I feel about it though.
It's completely normal to feel uncertain or anxious about starting insulin injections. How do you feel about the idea of injecting yourself?
Honestly, I'm a bit nervous about the whole thing. I'm worried about the needles and the pain. I've never had to inject myself before, and it just seems a bit overwhelming.
I understand. A lot of people feel the same way at first. The good news is that once you get used to it, it will become easier. The process is straightforward, and with a bit of practice, you'll feel much more confident. Let me explain why the insulin injections are important and how they work.
Okay, I'm listening.
Insulin is essential for controlling your blood sugar levels. Oral medications can only do so much, but insulin is faster and more effective. When you inject it, it goes directly into your bloodstream, bypassing the stomach where it could get broken down. This means your body gets the insulin it needs more quickly and efficiently. Am I clear so far?
Yes, that makes sense, I suppose. But I still don't like the idea of sticking myself with a needle.
It's definitely understandable to feel that way. However, over time, you'll get used to the process, and it will feel more routine. Let me guide you through how the injection works. First, before you do anything, you need to wash and dry your hands thoroughly. Clean hands help prevent any infections.
Okay, I can do that.
Great. Next, we'll choose an injection site. It's important to rotate the injection sites to avoid lumps or hardened areas that might reduce the absorption of the insulin. Typically, the areas around your abdomen or thighs work best. Once you've selected a site, pinch the skin lightly to create a little fold.
So, it's not just a straight poke.
Exactly. Pinching the skin helps ensure the needle goes into the fatty layer just below the skin, not into muscle. When you inject, you'll hold the needle at a 45 to 90 degree angle, depending on the length of the needle. Once it's in, you'll hold it in place for 5 to 10 seconds to make sure all the insulin is delivered. I hope I have cleared your doubts.
Yes, nurse, but what about the pain?
Don't worry, the needles are very fine, so most people experience little to no pain. A lot of people say it feels like a small pinch or nothing at all. If you're ever worried, you can always pinch the skin more firmly, which can make it feel less uncomfortable.
That's reassuring, but I'm still concerned about using the needle safely. What happens to it after?
Good question. It's very important to dispose of the needle properly. You'll need a special container for sharps, which you can get from your pharmacy. Please make sure that, never throw needles in the regular trash, as they can pose a danger to others. Always handle needles carefully to avoid accidents. Do you think you can do that?
I'll make sure to get one of those containers. What about storing the insulin? I've heard it has to be kept at certain temperatures.
Yes, you're right. Unopened insulin should be kept in the fridge, but once you start using a vial or pen, you can keep it at room temperature for up to 28 days. Just make sure not to expose it to sunlight or high temperatures. Also, always check the expiration date on the insulin, and don't use it after it has expired.
Then, I'll keep an eye on that.
Perfect. Now, would you like me to observe you while you try injecting yourself for the first time? It might help you feel more confident.
Yeah, I think that would be a good idea. I just want to make sure I'm doing it right.
Absolutely. Let's get started, and I'll guide you through each step. You'll see, it's easier than it seems.
Thanks. I'm feeling a bit better about this now. Let's give it a try.
You're very welcome. Let's go through it together, and remember, the more you practice, the more comfortable you'll get. You're doing a great job taking control of your health. Meanwhile, if you have any concern you can share with me. We are here to help you.
Okay, nurse, you cleared my all doubts. Thank you.